Hi everyone, my name is Neil Bobser. Welcome to Medscape Live on Facebook. I'm a second-year medical student and a contributor. We're coming to you live at the annual meeting in Chicago. We're also so glad that you could join us today, and we're pleased and honored to have our guest today, the incoming president of the American Medical Association, Barbara McAney, MD. Dr. McAney, technology and new discoveries are changing medicine at a breathtaking speed. Some of what I'm learning in medical school might be vastly different the second I get out into the real world.
Yes.
As a young physician to be, I'm interested in getting some sage advice from the generation before me before the seismic shift in medicine occurs, and we can use a lot of help in navigating the changing landscape in medicine as a whole. So before we start our discussion, I'd like to invite anyone to leave comments, leave questions on our Facebook Town Hall Q&A, and we'll be getting to them quite shortly. So right to our first question, what do you think are the biggest changes happening in medicine currently, and what sort of impact do you think they'll have on those of us who are just starting their careers?
I put those changes into two categories.
Mm-hmm.
One is the technical changes of how we can use data, population data, to have N of one type of studies where we can actually take the studies we read
Mm-hmm.
and adapt them to the patients we're seeing. So the data processes that we now have are a huge difference. And with that comes genomics, precision medicine, all the technological advances that surgeons are using of robotics and lasers and doing things through catheters.
Mm-hmm.
The technology is just expanding, and it allows us to do things we could never do before.
Mm-hmm.
I'm an oncologist, and the amount of treatment that I can give to patients today compared to what I could do when I was starting out in my career
Mm-hmm.
is wonderful. It is an incredibly exciting time to be
really
a physician.
exciting.
On the other hand, the other group of changes I would put in is the delivery system.
Mm-hmm.
Because all these technological advances and new modern medicines are of no use unless we can actually deliver them to patients in a way that patients can afford them. So we have a lot of work to do to make the delivery system catch up with the science.
Yeah, seems like it. That actually segues right into my next question, which is about artificial intelligence in medicine and how that's shaping the field. We see today IBM Watson, Google, DeepMind, they're able to scan millions of images and come up with a diagnosis instantly, which kind of I think might scare a few ophthalmologists or a few students who might be interested in ophthalmology or a few students who might be interested in radiology. So if you're a medical student currently, how should you see AI changing your future career landscape?
Well, I think not just medical students have to figure out how to work with AI, but all of us do, because as this volume of information comes forward, there is not going to be any one of us who can manage all of it. So I look at artificial intelligence or augmented intelligence as a way to use a computerized database, a programming system, to help me sort through the vast quantity of information coming at me and being able to sort it and do some of those tasks that computers are able to do very well. We have been working through our Council on Legislation and through a Board of Trustees report to look at how to integrate ethically augmented intelligence into a physician's practice, that it should be assisting the physician. You know, we must never lose sight of the fact that as physicians, we are also healers, and that when people are sick, they will always want a human being there who cares about them. William Osler said the first step of caring for the patient is caring for the patient. And I think that remains true today. So we can take this augmented intelligence, use it to gather and sort information, use it as a teaching tool with patients, use it to do some of the routine tasks that we currently do, but never lose track of the fact that that healthcare is one physician and one patient working together.
Okay, yeah, that sounds very reasonable. I'm glad the AMA is actually taking strides with the incoming AI revolution. I'm just looking if there are any questions currently. So Stephanie's asking, her husband is starting residency in a few weeks in pathology. Do you have any tips for the day?
Oh, pathology is going to have a lot of changes going forward as we So as an oncologist, I live and die by my pathologists and their ability to actually tell me what is the tumor that I'm treating and what are the genomics that are going to affect my decision making. So for pathology today, it's not just looking through a microscope. It's going to be analyzing data. It's going to be working with precision medicine and working with genomics. Pathologists are consultants to other doctors, and we need to look at it that way, that we will need the help of pathologists to be able to interpret some of this tsunami of information that's coming at us.
So our next question that we have here is that a recent study found that extra supervision from attending physicians did not reduce resident error. And in fact, extra supervision may have been associated with an increase in errors. Do you have any thoughts on how new physicians are being trained, and anything you think we could be doing better, or anything you think we should be changing in how we're training new doctors?
A couple comments on that. No one springs out error-free. You know, we all are going to make errors, and errors are part of the human experience. So what we need to be able to do with errors is not to punish the person who makes the error, but to look at the system behind that error and come up with ways using this wonderful technology and maybe augmented intelligence processes to say, how do we catch those errors before they impact the patient? And I think one of the things that we can do as we teach ourselves and new physicians team-based care, one of the most valuable parts of the team that I work with every day is I write chemotherapy orders. My nurse then, who's going to administer them, double checks them to make sure that they are in agreement with the evidence-based guidelines. My pharmacist then double checks them, and then the nurse checks them again. So before that chemotherapy is ever delivered to a patient in my office, they have 4 different sets of eyes looking at them to make sure that we are not going to do anything that would ever hurt anybody. So what we need to do as physicians is not go, you're a bad doctor, you made a mistake, we should punish you, but to say, let's create a system with enough redundancy in it that we can prevent any of those mistakes from getting to patients. The other thing I want to say about how residents and physicians are being trained is spend as much time in the outpatient area as you possibly can. 85% of healthcare occurs in the outpatient area, yet we are training physicians to work in hospitals. Our goal, because hospitals are the most expensive part of the healthcare system, should be to keep our patients healthy enough that they don't have to be in the hospital. And if you can learn all of the things that you can do in the outpatient world to manage the chronic disease, which is 90% of healthcare spend, and keep those people healthier, they will be living a better life, and the system will be less expensive.
Yeah, that sounds very reasonable. So we have a few interesting questions, I think, from the crowd. Jeff's asking that he would like to know about physician burnout, especially in light of reports showing physicians have sought the highest suicide rate of any profession.
Yes, this is devastating. The idea that we lose 400 doctors a year to suicide.
Yeah.
And I read that 200 medical students and residents every year kill themselves. This is unacceptable. I think there are several facets to burnout, and I've been doing a lot of reading, and as I go around the country, I talk to a lot of physicians, and I'm seeing burnout in multiple sectors, but I'm seeing some differences depending on employment status. If people are employed by a hospital system, their burnout relates to having a feeling of powerlessness to bring the goals that they have as a physician in alignment with the goals of the institutions. And we need to empower physicians who choose hospital employment to know how to do the tools of business, the tools of power, so that they are able to work in their institution to align that institution's goals with what their goals are of making patients healthier. The electronic health record and all of the data requirements and all of the prior authorization hassles, I hear from both employed physicians and self-employed physicians that every time you want to do anything, standard of care, literature-based, you still have to play Mother May I with the insurance company.
Yeah.
And after a while, that's just angering. It's just frustrating. So as you go through the day, that level of frustration builds. So what the AMA is doing is we get this. We are doctors. We are practicing doctors. And we feel these things firsthand. So we are working with insurance companies to try to be able to say, let's get rid of some of this prior authorization nonsense. We are trained professionals. We know what the right thing to do is for our patients. You don't have to put us through this process every single decision we make. And then we also need to look at a lot of the solutions of how to make people's practice more efficient. In private practice, if I have a medical assistant who doesn't work well with me and get my patients in a room or be nice to my patients, that person doesn't have to work there very long. If you're working in a hospital system and you can't control the people that you're working with, the team you're working with, if there's friction there, that contributes to burnout.
I see that.
So I think a lot of it is having physicians back in control of their own daily work environment, their own way of delivering healthcare. And so at the AMA, we are trying hard to work on multiple of those issues.
Yeah, no, that's very exciting stuff. I'm glad to hear that. As an incoming medical student, hopefully going to be a doctor one day.
Yes, you will.
Just tough out there. So our next.
It's the best career ever.
Oh yeah, of course.
It's the best career
I couldn't
ever.
think of going into anything else.
Yeah.
I knew that medicine was what I wanted to be in. Now it's just a matter of picking the specialty. So we have a question from Avinash who says, what should the UK physicians who are struggling to achieve medical licensing to practice in the US do? So how are IMGs really going to be affected in the incoming years?
Well, a third of healthcare, or a quarter, around that amount of healthcare in the country, in the US, is delivered by international medical graduates.
Okay.
And we have put some barriers between them being able to get into the system and not recognizing that there are excellent medical schools in other parts of the world where people are well trained. So what the AMA has been doing is we have our medical education processes where we're trying to change medical education. We're also trying to add about 15,000 slots for graduate medical education. And our international medical graduate section at the AMA has several resolutions that will be presented at this House of Delegates to look at whether or not there are ways that we can streamline people coming from other countries who wish to help us with our doctor shortage here in the U.S. and to make sure that we can work on that. We also wrote a letter pointing out when the travel ban was instituted by the president, we sent a letter stating that this will adversely impact healthcare in the entire United States if we are blocking people from coming to this country. So there's a lot of different things that we are doing on the macro level. On the micro level, every situation is so different, and the immigration laws are pretty complex. The first thing I would do is to say, get a good immigration lawyer and work with that person to figure out what you as an individual need to do to be able to complete your career here in the U.S.
So you brought up politics, which is definitely something that everyone's thinking, especially today. So switching gears, how does the AMA really, encourage students to get involved in advocacy? And how has AMA's advocacy shaped American politics?
The medical student section is often the moral compass of the AMA. So they have a very impressive voice, and they come forward with resolutions. So the way we work as a very democratically built organization is, if you, a medical student or a practicing physician, any person, any member of the AMA, wants to bring forth an item that you think we should be working on, the first thing you do is you write a resolution, which basically says, whereas A, B, and C, I think the AMA should do X, Y, and Z, whatever your issue is. And then as you work with that, you can take that to your medical student section, and if you can convince enough of your peers that you have the right idea, then that comes forward to the House of Delegates. And then you have to create a momentum among others of your peers. And if that resolution is passed, then that becomes the policy of the AMA.
Okay.
And once that's the policy of the American Medical Association, that is where we take our advocacy marching orders. So, for example, one of the biggest issues that we got from the House of Delegates was we want more people to have insurance and have access to health care. That's kind of basic. I mean, we're doctors. We think people should have access to health care. So when we look at any of the bills that are coming out of Congress, we stack them up against the AMA policies, and if the majority of it agrees and it advances our policy, then we support it. If it looks like it's pushing our policy back and disagreeing with us, then we oppose it. And that's how we make those decisions. It's directly related from the input we get from every member of the House of Delegates and all of those sections. So my advice to medical students is get involved now. Go to your university, your medical school will have a medical student section. If it doesn't, talk to the state or the county medical societies. Create a medical student section. Get one of the members who are in that house at your state or county level. They'll teach you how to write a resolution. It's not hard. This is not the Krebs cycle we're talking about. And you can write that resolution. We never use a Krebs cycle.
Okay.
But once, they still teach that.
They still teach it.
But once you have this policy issue that's brought forward, your state or county society or your specialty society will help you bring that forward and make that AMA policy. And then we put the machinery of the AMA in motion behind your idea.
That's actually super exciting. I know a few resolutions out on the floor that are moving forward, and excited to see how they're going.
The medical students bring forth a lot of our public health issues over the years. Students today are dealing with gun violence. Our medical students have brought forth several resolutions on that. The medical students who are politically aware of what's going on in the world around them have brought issues to us over the years that have opened the eyes of people who were, I'm busy being an oncologist, and some medical student brings up this idea, and it's like, oh, I had no idea this was happening because it's in obstetrics or it's in a different field. You learn so much at the House of Delegates. You learn so much.
That's really cool. That's really exciting. So someone was asking earlier, I think it was Maria Belencajas, and she was asking, do you have any advice for young doctors who haven't decided on a specialty yet?
Try as many of them as you can. I think actually it's healthy to not have decided on your specialty at age 3.
Okay, that's good to know.
Because you don't really know. I mean, I would define success as finding something that you really love doing and getting somebody to pay you for it. So if you try various things and you discover that you really enjoy this group of patients or you really enjoy this particular process, then you're starting to hone in on it. So what I advise first is figure out if you're somebody who likes to cut or not to cut. So it's the surgical specialties or the medical specialties. And for me, when I was in medical school and I realized I had to write a paper, every time I turned around, I was back on the floor talking to patients. And I thought, if I really like talking to patients and I don't really like writing papers, why am I considering an academic career? I should go into something where all I do is take care of patients because I really love it. So it's like, okay, move my career plan that direction.
On that, that sounds amazing. That's great advice. I was just wondering, I guess, how did you come to oncology? Like, what drove you there?
I fell in love with I rotated on the acute leukemia ward at the University of Iowa as a third-year medical student. And I fell in love with every leukemia patient I met. I realized that in oncology, you get to know people so quickly. Things that people tell you, amazing things that otherwise you'd have to be friends for 20 years to know.
Wow.
That you really, and medicine does this, not just oncology, but in medicine, that relationship between the doctors and the patients is so privileged You get to know people so well, so quickly, and insights into them that you would never otherwise see in any other profession, that's valuable. And that is incredibly rewarding. And, I think that's part of the burnout issue. That's what drives physicians, is that you want to do a good job because you know this person and you care about them. But if you're on a treadmill cranking out more RVUs and you can only see someone every 8 minutes, how do you build a relationship in 8 minutes?
Yeah.
So I think that's some of the frustrations that I hear from physicians. So keep working on that. Find out what it is that really charms you when you're working with patients.
Okay. I guess those are all the questions we have for today. Do you have any last minute advice for any future medical students, any young doctors out there who are aspiring to become great physicians such as yourself and as accomplished as you are?
Well, come join us at the American Medical Association, because working through the American Medical Association brings you out of your little niche that you find yourself in as a medical student or as a physician. It lets you see what the broader world is like. It lets you see from other physicians and other specialties and other communities that you all face common problems, you all have the same challenges. We have so much more that we have in common that we have separately, that you really understand that camaraderie that exists between physicians, and that is an incredibly special thing. Don't deprive yourself of that.
Yeah. Well, that's all the time that we have. Thanks so much for joining this Medscape Live on Facebook from the AMA conference in Chicago. Be sure to check back for more great content on medscape.com and our social media accounts. We actually have a young physician compensation report for the year of 2018. So if you're interested in that data, definitely check it out. It's on Medscape, medscape.com. Again, my name is Neil Bosser, second-year medical student and reporter for Medscape. Thanks so much, Barbara McEnany, MD. I'm sorry. Thanks so much, Dr. McEnany, for sitting down with us.
My pleasure.
My first time, so I'm a little nervous. But thank you so much for sitting with us. Goodbye.
My pleasure.
Okay. And